Hey future nurses, welcome back to the channel. In today's video, we're diving into one of the most critical concepts you need to understand for your nursing journey, your scope of practice. Whether you're just starting out in nursing school or you're preparing for the NCLEX, understanding your scope of practice will protect you, your patients, and your career. First things first, what exactly is scope of practice? Simply put, your scope of practice defines what tasks and responsibilities you are legally allowed to perform as a nurse. It's not just about what you're asked to do. It's about what your license allows you to do safely and competently. For nursing students, this can be tricky because while you might be taught certain tasks in school, your State Nurse Practice Act, which is a law that governs what you can and can't do as a nurse, might have specific limitations. For example, if you're trained in something like starting an IV, your state laws might say that only RNs can perform that task. Now that we understand what scope of practice means, let's take a closer look at the key factors that shape it, starting with the State Nurse Practice Acts. State Nurse Practice Acts. These laws vary from state to state, outlining what nurses are legally allowed to do in that jurisdiction. And then we have workplace policies. Every hospital or healthcare facility has its own set of rules and protocols. These can expand on what's allowed by your state, but they can't go beyond the legal limits set by the law. Then we have standards of care. Professional organizations like the American Nurse Association set standards for nursing practice, which you must follow. Now, why does all of this matter? Because stepping outside your scope of practice can have serious consequences. If you perform a task you're not licensed to do, you could harm a patient or you could face legal consequences, including the risk of losing your nursing license. And that's not something you want to risk. Imagine a situation where you're asked to administer a medication you're not trained to give, or perhaps you're asked to perform a procedure that's outside of your skill set. Even though your employer may request it, you don't have to comply if it's outside of your scope. Always ask questions, clarify, and protect your license. But here's the thing. There are some gaps in nursing education that make this even more important. While nursing school will teach you the basics of patient care, some programs might not give you enough exposure to your state-specific laws or your employee-specific protocols. Sometimes nursing students aren't taught how to recognize scope violations in real-world settings, or they may not fully understand how to balance agency protocols with state laws. You might be asked to do something outside your scope of practice just because a hospital is short-staffed or an experienced nurse assumes you're ready. So how do you protect yourself? 1, know your state's Nurse Practice Act is critical. 2, follow your agency's policies and protocols. These are just as important. 3, ask questions if you're ever unsure. It's always better to double check than to risk stepping outside of your scope. Trust me, it's not worth it. Thank you for watching this video, and if you found this content useful, please don't forget like, comment, share, and subscribe.